My name is Dr. Sarah Mitchell, and I have been a plastic surgeon at Manhattan Medical Center for 8 years. I have seen everything: celebrities hiding their identities, people fixing accidents from decades ago, and patients with unrealistic expectations. But nothing, and I mean nothing, prepared me for what walked into my office on that rainy Tuesday morning in October. Her name was Isabella Rodriguez, 28 years old, absolutely stunning. She had this ethereal beauty that made you stop and stare. Perfect bone structure, flawless skin, and these piercing green eyes that seemed to look right through you. She wanted a simple rhinoplasty, nothing major, just a small bump on her nose that, frankly, I could barely see. "Dr. Mitchell," she said in this soft, almost musical voice, "I know it seems minor, but this has bothered me my entire life. I just want to feel normal." Normal? This woman was anything but normal. She was extraordinarily beautiful. But who was I to judge? I had learned long ago that beauty is subjective, and if this small imperfection bothered her enough to seek surgery, then we would fix it. During the consultation, everything seemed routine. Her medical history was clean. No allergies, no previous surgeries, no medications. She was the ideal candidate. What struck me as odd, though, was how she kept touching her neck, almost unconsciously, as if something was bothering her there. "Is everything all right with your neck?" I asked. She immediately dropped her hand and smiled. "Oh, just a little stiff from sleeping wrong. Nothing to worry about." But there was something in her eyes when she said it, a flicker of fear? Nervousness? I could not quite place it. We scheduled her surgery for the following week. As she left, she turned back and said something that still gives me chills. "Dr. Mitchell, promise me that no matter what you find, you will finish the surgery." Find? What did she think we would find during a simple nose job? I should have asked more questions. I should have trusted my instincts. But I did not. And that decision would change everything. The day of Isabella's surgery arrived, and she showed up exactly on time. She seemed nervous, more nervous than most patients, but I attributed it to normal pre-surgery anxiety. My surgical team consisted of Dr. James Park, my anesthesiologist, and 2 nurses, Maria and Jennifer. We had worked together countless times, and they knew my procedures by heart. As we prepared Isabella for surgery, something unusual happened. When Dr. Park tried to insert the IV, he had difficulty finding her veins. This was strange because Isabella appeared to be in perfect health with no signs of dehydration or poor circulation. "Doctor, her veins are different," Dr. Park whispered to me. "They feel harder than normal, almost like there is something underneath them." I examined her arm myself. He was right. Her veins felt unusual, but I had never encountered anything like this before. Isabella was already sedated, so we could not ask her about it. "Maybe it is just genetic variation," I told Dr. Park. "Let us proceed." As we moved Isabella to the operating room, Nurse Maria noticed something odd. "Dr. Mitchell, look at her heart rate monitor." Isabella's heart rate was incredibly slow, only 40 beats per minute. For most people, this would indicate a serious problem, but her other vitals were stable. Her breathing was normal, her blood pressure was perfect, and her oxygen levels were excellent. "Should we wake her up?" Dr. Park asked. I looked at Isabella's peaceful face. Everything else seemed fine, and she had specifically asked us not to stop the surgery no matter what we found. Against my better judgment, I decided to continue. "We proceed, but monitor everything closely," I instructed the team. As I made the first incision along her nose, something immediately felt wrong. The tissue was different, denser, almost metallic in texture. I had performed thousands of rhinoplasties, and this was unlike anything I had ever encountered. "Maria, hand me the larger scalpel," I said, trying to keep my voice steady. As I cut deeper, expecting to see the normal nasal cartilage and bone structure, my scalpel hit something hard, something that definitely should not be there. "What the hell is that?" Dr. Park muttered, looking over my shoulder. Embedded in Isabella's nasal structure was a small metallic device about the size of a marble. It was perfectly spherical, made of some kind of unknown metal that seemed to shimmer under our surgical lights. "Should we remove it?" Nurse Jennifer asked. I stared at the device, my mind racing. This was not medical. This was not natural. What was this thing and how long had it been there? I had two choices: wake Isabella up and ask her about this device, or continue with the surgery as she had requested. The device did not appear to be causing any immediate medical problems, but its presence raised serious questions. Dr. Park, is she stable? I asked. Completely stable. Heart rate is still slow, but everything else is normal. I made the decision to carefully extract the device. Using precision instruments, I slowly worked it free from the surrounding tissue. As soon as I touched it with my surgical tools, something incredible happened. The device began to emit a soft, pulsing light. Is it alive? Maria whispered. Maria. The device was warm to the touch, and as I held it up to examine it more closely, I could see intricate patterns etched into its surface. They looked almost like circuit boards, but far more complex than any technology I had ever seen. Should we call someone? Jennifer asked. The FBI, the military? Before I could answer, Isabella's vital signs suddenly changed. Her heart rate jumped from 40 to 120 beats per minute in seconds. Her blood pressure spiked, and she began showing signs of distress even under anesthesia. She is reacting to the removal of the device, Dr. Park observed. Her body is going into some kind of shock. I quickly placed the device in a sterile container, but Isabella's condition continued to deteriorate. Her skin began to change color, becoming paler, almost translucent. Under the surgical lights, I could see what looked like a network of thin lines running under her skin, like some kind of internal circuitry. My God, I breathed. What is she? Suddenly, Isabella's eyes snapped open, even though she should have been deeply unconscious. She looked directly at me, and her green eyes were now glowing with the same light as the device. Dr. Mitchell, she said, her voice perfectly clear despite the anesthesia, you were not supposed to remove that. The entire surgical team froze. Patients do not wake up and speak coherently during surgery. Patients do not have glowing eyes. And patients certainly do not have mysterious devices embedded in their faces. Isabella, what is that device? What are you? I asked, trying to keep my voice professional despite the fear creeping in. She sat up on the operating table, completely ignoring the fact that she should be unconscious. I am sorry you had to see this, Dr. Mitchell. I really am. I came here hoping you could fix my appearance without discovering this. She gestured to the device in my hand. That is my life support system. Without it, I can only survive for a few hours in your atmosphere. Your atmosphere? Dr. Park stammered. Isabella smiled sadly. I am not from Earth, Dr. Mitchell. I am what you might call a refugee. The operating room fell into complete silence except for the steady beeping of the monitors. Isabella, or whoever she really was, remained sitting calmly on the surgical table, looking at each of us with those glowing eyes. I know this is impossible for you to understand, she continued, her voice gentle but urgent. My people have been living among humans for decades. We look like you, we act like you, but we need these devices to survive in your environment. I was still holding the metallic sphere, which continued to pulse with that soft light. Why did you come here? Why risk exposing yourself for cosmetic surgery? Because I wanted to be normal, she said, and for the first time I heard real emotion in her voice. I have been living as Isabella Rodriguez for 3 years. I have a job, friends, someone I love. But this small bump on my nose, it is not natural to your species. Anyone with medical knowledge who looked closely might realize it was not human bone structure. Dr. Park found his voice. How many of you are there? How? More than you might think, fewer than you might fear, Isabella replied. We are refugees, Dr. Mitchell. Our planet was destroyed by war. Earth was the closest habitable world, but your atmosphere is toxic to us without these life support devices. She pointed to the sphere in my hands. That device filters your air and adjusts my body chemistry so I can survive here, but it also maintains my human appearance. Without it, I will begin to revert to my natural form within hours. As if to prove her point, I noticed that her skin was becoming more translucent, and those circuit-like lines were becoming more visible. Her hair was changing color, shifting from dark brown to an almost silver shade. "What happens if we give this back to you?" I asked. "I return to my normal human appearance and you continue the surgery as planned. I go back to my life as Isabella Rodriguez, and you never see me again." "And if we do not?" Isabella's expression grew sad. "Then I die, and your government will eventually find my body and learn that we exist. That discovery will not end well for my people." Nurse Maria stepped forward. "There are others like you, living normal lives? Teachers, doctors, store clerks, even other medical professionals. We are not invaders, Dr. Mitchell. We are survivors trying to build new lives while harming no one." I looked at the device in my hands, then at Isabella, whose appearance was continuing to change. Her eyes were now completely silver, and her skin had a faint luminescent quality. "If I give this back to you, how do I know you are telling the truth? How do I know you are not dangerous?" "You do not," Isabella admitted. "You have to make a choice based on what you have observed. In 3 years as Isabella Rodriguez, have I harmed anyone? Have any of us?" The room was quiet, except for the monitors. Isabella's heart rate was dropping again as her body struggled without the device. "Dr. Mitchell," she whispered, her voice growing weaker, "please, I just want to live a normal life." I stood there holding this alien technology, facing the most important decision of my medical career. Everything I thought I knew about the world had changed in the span of 30 minutes. But as I looked at Isabella, this being who had trusted us with her life and her secret, I realized that the choice was not as complicated as it seemed. "Dr. Park, Maria, Jennifer," I said, addressing my team, "we need to make a decision together. What we do here today affects not just Isabella, but potentially her entire people." Dr. Park was the first to speak. "She could have hidden this from us. She could have gone to a less reputable surgeon who would not have noticed the device. But she came to one of the best hospitals in the city. That says something about her character." Maria nodded. "In 3 years, if there were others like her causing problems, we would have heard about it. Strange disappearances, unexplained incidents, but there have not been any." "So we are really going to help an alien with cosmetic surgery?" Jennifer asked, but she was smiling as she said it. I looked at Isabella, whose silver eyes were growing dim. "Yes, we are." I carefully reinserted the device into the tissue around her nasal cavity. Almost immediately, Isabella's appearance began to return to normal. Her skin regained its human color, her eyes shifted back to green, and her hair darkened to brown. "Thank you," she whispered as the anesthesia took effect again. The rest of the surgery proceeded normally. I carefully worked around the device, reshaping her nose to appear completely human while ensuring the alien technology remained undisturbed and hidden. It was the most challenging surgery of my career, requiring precision I did not know I possessed. 3 hours later, Isabella Rodriguez woke up in recovery with a perfect human nose. When she was fully alert, I sat beside her bed. "How do you feel?" "Normal," she said, smiling. "Finally normal." "Isabella, I have to ask, are there others like you in the medical field?" She nodded. "A few. We try to help when we can, especially with cases that human medicine cannot explain. Sometimes what you call medical mysteries are just problems we understand better than you do." Before she left the hospital, Isabella handed me a small card with just a phone number on it. "If you ever encounter something that human medicine cannot explain, call this number. We will help if we can." That was 2 years ago. I still have the card, and I have used it 3 times for cases that seemed impossible. Each time, I received guidance that saved a life. Isabella Rodriguez still lives in Manhattan. She works as a translator for the United Nations, helping refugees, human refugees, start new lives in America. Sometimes I see her around the city, and she always smiles and nods. To everyone else, she is just another beautiful woman living her life. But I know the truth. And sometimes when the world seems too small and too familiar, I remember that there are wonders hiding in plain sight, and that kindness and humanity exist in forms we never expected. The universe is far stranger and more beautiful than we ever imagined, and sometimes it just needs a little plastic surgery to fit in.